So welcome back for those who have been with us this week for our other sessions, and to those who are joining us for the first time today, thank you so much for coming. We are really happy you're here. And we are excited today to explore the experiences of our kinship families as it pertains to the research context in our program. And we'll be talking a little bit more about our program in depth. I know we've been promising that all week. Okay, so today what we'll be focusing on is we'll start off the same way. We want to hear from you and see who you are, and then we'll talk to you a little bit more about Kin Carolina and what we do and how we're studying it. And then the bulk of our time is going to be spent with our stakeholders here. We have staff members, peer liaisons, alumni, and so we are excited to hear from them. Oh, and community partners, advisory council members. Sorry, Rachel. We are excited to hear from all of them and their different perspectives about their experiences. And then we'll, of course, open it back up to you and hear your questions and also your thoughts. At the end of today's session, you'll be able to describe the 4 components of our intervention and identify at least 2 benefits and challenges of engaging kinship caregivers in a rigorous research design. So again, we want to learn about you. I see people introducing themselves in the chat, and that's awesome. Let us know where you're from. I know, like I said, some of you have shared in the chat, but you can just click on the map. This is the one that I don't think works well with text messaging. Our Carolina friends are back.
Yes.
But we're glad to see people in other parts of the country as well. Thank you. All right, moving to the next question. How are you connected to kinship care? Glad to have some kinship caregivers on the call too. But thank you so much. We're so glad to have a range of stakeholders here, and we're excited to learn from you as well as sharing with you today. I'm sure you've all been waiting to hear a little bit more about Kin Carolina. You have been hearing bits and pieces and witnessing some bits and pieces over the course of this week, but we're going to lay it all out for you today. We did share this the other day, but just the basic overview is that we were funded by the Duke Endowment. We're very grateful for 5 years of funding to develop Kin Carolina and to measure it and study it. So we are aiming to provide evidence-based supports for kinship caregivers, specifically those who are raising children with disabilities or special health care needs. And we will talk a little bit more about what that means and how we define that. On this map are the counties that we're currently serving. We're in South Carolina right now. We started with the counties in yellow, which is loosely the Midlands region, plus or minus a few counties that people said they also included in the Midlands region. And then this is kind of our official announcement this week that we are starting an expansion into the Low Country region, so those blue counties on the map. And so we're excited to be able to start supporting caregivers from a larger portion of the state. As part of our grant, we do have built in a plan to expand a little further and to also expand into North Carolina. So for our friends on the call who are from North Carolina, you may hear from me, you may hear from our team, because we really want to get to know the landscape in North Carolina and where we can best serve caregivers. Well, I didn't even introduce myself, did I? I'm Amanda Klein Cox, and I am from UNC Chapel Hill School of Social Work, and I'm the project implementation manager for Kin Carolina. I guess I just assumed you all knew me now, but we are definitely more than just UNC School of Social Work. We are a partnership of many organizations. The University of South Carolina's College of Social Work has been a huge support as well. Our colleague, Dr. Yangfang Xu, who you'll see in a video a little later, is a critical partner, as is Kindred Hearts of South Carolina, and Dr. John Ha there has been our implementation site. Those are our main partners for implementation. And then we also have a number of other friends and colleagues from across the country who are supporting the project evaluation, and they helped develop the program as well. So we have colleagues from the Catholic University School of Social Service, from Arizona State University and Ohio State University's Colleges of Social Work. So this is just a snapshot of our team. You can see it's a team of strong women from across the country who really care about kinship care, and they've been really instrumental in helping us build this out. So about the program, who are we serving? So to just provide a basic definition of kinship care, if you're new to the call, because a lot of you said you wanted to learn more, we define kinship care as relatives or close family friend who have brought in children who are not their biological child and are raising them as their full-time caregiver. So this can happen for a variety of reasons when the parent isn't able to care for them. Sometimes the parent may have died. Other times the parent may be incarcerated, or there could be mental health or substance use issues. There could be issues related to poverty or homelessness. There's a really wide range of circumstances that could lead to kinship care. And also kinship caregivers look really different. We often hear about grandparents raising their grandchildren, but we've even had in our program school staff who have stepped up to raise a child in need from their school community, friends, step families, godparents, etc. I mean, it can really be a wide range of people who just care about a child and want to see them thrive. So for our purposes, in terms of who we take in our program, any kinship caregiver, anyone who, whether you come through the child welfare system, what we call formal care or not, you are welcome in Carolina. We just ask that the child has been placed with you for at least a month to get over that initial adjustment period, and that you anticipate that the child would remain with you for at least 6 months, because our program is 6 months long and it operates on a rolling basis. So people are coming in and graduating all the time. But in order to stay in the program, you do have to have a child in kinship care. As I mentioned, we are specifically focusing on families whose children have additional needs, kind of above and beyond the developmental norm. And so I'll talk about that in a future slide. And then we need to update this one, but we do ask that our caregivers are a resident of the counties that we identified, which is now beyond the Midlands region in South Carolina. Okay, so how we define disability. Like I said, we decided to be intentionally broad with our definition because we know that so many children have entered care in a context of trauma, and sometimes coping mechanisms for trauma can look a lot like symptoms of a disability. And so we do not require a diagnosis, that the children of the caregivers have a diagnosis. We follow this definition from the CDC, that a disability is any condition of the body or mind that makes it more difficult for the person with the condition to do certain activities and to interact with the world around them. So we're really looking at kind of this intersection of functional limitations and needing some support, as well as these 3 dimensions that the World Health Organization identifies. So some type of impairment, activity limitation, and restrictions on participating in their activities in daily life.
Just to give you all an idea of how we capture this realistically when screening participants, we do meet with them and ask open-ended questions, not technical using these words, but questions like, how does your child do at home? How does your child do at school? Do you notice differences in needs for your child compared to other children their age? So just to show we're really asking them those functional questions to see how their children are affected, even if there is no diagnosed condition or disorder. So we do, again, define it very broadly, and we realize that children can be impacted in different ways and in different settings. So we'll talk the caregivers through that when deciding if they're eligible or not.
Thanks, Angela. So this is our theory of change. We strongly believe that if we support caregivers, that their well-being will improve. And by the consequence of that, the well-being of the child will improve. And so this is what we are looking to impact, and what our study does examine to see if we are able to make this theory of change turn into actual change for our caregivers. So, as I mentioned in our objectives, there are 4 components to our program. And if you've been with us at all this week, you have seen a few of them in action. So, yesterday you saw a simulation of an interaction with a peer liaison, which is a one-on-one mentor of someone who's already walked the walk. They have been a kinship caregiver for a child with a special health care need or disability, maybe just for a little bit longer. And that's the one-on-one peer support. We also have virtual support groups for all of the participants in the program, and we offer those 2 times out of the month. And then each time we offer them, we offer 2 time options. And then we have a monthly training session. Like I mentioned, the program is 6 months long. So we have a 6 session series, and we just keep it rolling as new people come in. And our trainings are on everything from self-care to trauma, the sensory system, navigating the IEP process in schools, and other types of content that actually got identified during a needs assessment that we'll talk about in a little bit. Oh, I see a great question in the chat. The services are for the caregiver, not for the child. The child's age is only for the initial eligibility. We do ask that they are, legally a child, so that they have children under 18. But as Ms. Pat was alluding to in our support group simulation yesterday, it never stops even once the kids get older. But for the purposes of eligibility, the caregivers have to be over 18 and the children under 18. And then finally, our last component is financial, because we know that taking a child or multiple children into your home at the in the blink of an eye brings along a lot of financial consequences, and does not usually have the financial supports to meet those. So we do offer our participants $450 a month for the 6-month program. We also have benefits consultations and a support fund for more emergent needs. And it is our goal that all of these supports work together. So, for example, if a caregiver was seeking an evaluation for their child who is demonstrating some difficult behaviors, we would hope that the training session might tell them how to go about doing that. Their peer liaison might be able to share their experience and give some guidance about, providers to contact or where to go. The support groups, they would be able to hear from other people who have experienced that, and also just get a chance to share their feelings about it, about the process, and maybe the frustrations. And then finally, maybe the financial component could offset some costs, such as transportation or doctor and specialist co-pays or things like that. So it's our goal that these all are complementary supports. Our final component of the program is an advisory council, and you'll hear from one of our council members today. And this is really to look at the macro level for the social workers in the room, the big picture here of how do we look across systems to better support kinship families. And so our council is comprised of people from across the Carolinas, both states, across different systems, people with lived experience and professional experience. We also have our peer liaisons. They have the option to serve on our council if they would like. So we really try and lift up a lot of voices and get a lot of perspectives on these really critical issues. And the council is really the body behind this whole event this week. All right, so this is a session about research, right? So I would love to hear from you about, maybe you don't know a lot about kinship, but likely as people in the human services or caring community members, you have dealt with other vulnerable populations. What are some important considerations for conducting research with those populations? Culture, absolutely. And yes, every family, and especially every kinship family, is unique. Informed consent, availability, a lot about culture. Should have done a word cloud for this one. Building trust in the chat. I love that. Language barriers. Making people feel comfortable and empowered. Love this. The grief and loss piece is really important. We definitely heard that in the support group last night. Barriers to services. I'm seeing that a bunch. Ooh, power imbalance. That's great. Financial status, easy access, incentives. Lots of great considerations here. Ability to appropriately care for children. Yeah, we may run into some ethical things, huh? Are they willing and available? Mental health concerns. Yes. Best interest of the child. These are really great. Individual needs of all members in the household. The caregiver's ability to navigate things is really important, and we're going to talk a little bit about that today, too. All right. Well, these are some really great suggestions, and keep them coming. Feel free to keep that open and keep looking and adding them in the chat. We just want to share what our perspective on research is, and then we'll talk a little bit more about what we're actually doing and what that looks like in real life.
When I started studying kinship care years ago, there was a lot of stigma attached to the practice. Social workers were reluctant to even place children with relatives. In fact, in many states, it was written into policy that relatives didn't even get first right of refusal. They weren't even considered when we were looking for placement for children. But it has evolved in a good way. Many states now, kinship care is the first response as opposed to never being considered. We like to think that some of that is due to the research, where we know that kids have better outcomes when they're in relative care.
Our current research really is almost to look at what is old is new again in terms of kinship care, valuing those kind of informal adoptions, but now we're calling them kinship care experiences, where we really appreciate the sacrifice while at the same time understand the support that continues to be needed by these families.
Today, kinship care is studied in a very rigorous manner. Kin Carolina is one of those studies that uses a randomized controlled trial where we are placing a group of kinship caregivers in an intervention and then a group who are getting treatment as usual. We're delivering that intervention for 6 months, and then we'll follow the families for another 6 months to trace their outcomes. But we'll be able to prove the efficacy of these services at the end of this 5-year demonstration.
Children in kinship care, they fare much better than children in other types of out-of-home care. Also, kinship care provides kids a cultural connection and more stable environment. So that motivates me to do more research in this area.
I don't know if this is what the future looks like for kinship care research, but this is what I hope. I hope that it is interdisciplinary, that we start talking across systems so that we can actually wrap supports around kinship families and understand not only from the practice side, but from the policy side, and also even just the impacts, the research side, what is happening to kinship families in different systems and what happens to them. How much better could things be if these systems are talking and working together? It can't just be research in isolation. It really has to be policy, practice, research, all of those things. But I really hope it's people working together a little better.
Kinship caregivers are unsung heroes. No matter how we refer to them, informal, formal, public, or private, they're the ones keeping our children safe, protected, connected, and filled with a sense of belonging and love. No matter the path that kinship families find themselves on, they are deserving of support and resources. We need national and state policies to better align with what the research is demonstrating. Research has proven that children reared in kinship homes experience better outcomes than their counterparts. They do better academically, physically, and socio-emotionally. We achieve stability and permanency for children when they are raised in kinship homes. However, the key is to provide targeted and evidence-informed support to caregivers. If we want our children to be healthy, thrive, and to experience well-being, we must attend to the needs of caregivers. Our caregivers are strong, resilient, and deserving of our investment in their well-being and ongoing health. When we focus our policies, programs, and research on the needs and well-being of kinship families, we are preparing generations of healthy, happy, and high-functioning children and adults.
All right. Thank you for watching that. So as Ramona, hopefully you got to see Ramona speak on our first session, but as she mentioned, we are studying Carolina through a randomized controlled trial. We chose that for a reason because it is really the most rigorous way to be able to see if and isolate effects from a given intervention. And it is a goal of ours to become an evidence-based practice in child welfare so that we can replicate and hopefully help other families beyond the Carolinas. So with a randomized controlled trial, anyone who is in the study who enrolls, and we can talk more about the consent process as well, but anyone who enrolls is clearly informed. They're walked through our consent form, which tells them that if they decide to enroll, they will be randomly assigned either to receive everything I have described or to what we call our services in the community group. And it was really important to us for a lot of the reasons that were mentioned in the poll everywhere. It was really, really important to us that no one got left with nothing. These are people who are reaching out for help, and that's really critical. And we didn't want to leave them with no help at all. So the people in our control group get $100 a month for the 6 months for filling out our surveys. And then they also get, I think it's up to 70 pages now, this giant resource guide that we have developed for all kinds of resources, family resources, basic needs, legal resources, housing, resources pertaining to individuals with disabilities, all kinds of things from their particular counties all the way through national resources. And we know that sometimes that's not ideal, that some people would, are disappointed that they get randomized to the control group, but we do try to emphasize the benefit of understanding the impact of this program on kinship families, making sure that what we do works, and to see if it really impacts well-being. So our main portion of the evaluation comes through surveys. And so both groups are surveyed when they enroll, after 6 months, which for those receiving the Carolina program is when they graduate, and then 6 months later. So we are studying people for a year. We also do kind of exit focus groups with caregivers once they graduate, and then we do annual focus groups with our peer liaisons. We also do surveys of our peer liaisons and advisory council, although they are lucky they're a lot shorter. And we have a ton of other administrative data, such as program attendance and things like that, to help us understand how people participated in the program. So it's really important for us to not only have integrity in our research model, but also be culturally responsive to the people we are serving. And that is a fine balance. And it comes up regularly in our meetings as a way of, balancing this in the real world, because not all situations are cut and dry. So there's a bunch of different ways that we go about doing that. So one is accessibility. I mentioned that we have a lot of different times that we offer our support groups. We also offer things through different modalities. We have our trainings recorded so they can watch them at a time that works for them if they can't do the live one. We also have tried to make our surveys and things and documents more accessible, and have learned a lot ourselves about what accessibility means, having audio recordings of things, making sure there's alt text for documents, things like that. As you can probably tell hopefully can tell from this week, we really value including those with lived experience. So our peer liaisons are a critical source of feedback for us. Like I said, they're on our advisory council. We do our focus groups to hear and get feedback from our caregivers who participate. We also did a big needs assessment ahead of time to learn about the needs of the community, especially since some of us were coming from outside of the community. This is really critical for us. And recognizing that a lot of the people coming to us have a high level of need, and that we need to be responsive to that. Because of all of these things, we want to make sure that we are really transparent about the research process. When someone wants to join, they will fill out a screening or referral form for us. And then if they're screened in, then they have a meeting with one of our staff members where they walk through every aspect of this. So the consent is not a mystery to them. They're not just being left with this lengthy form. They're really understanding what this research design means for them, and also what some of the benefits are to participating no matter what group they're randomized into. I'll just go quickly through these. There are also things about the research design that are tricky to balance. We don't love, in practicality, our human service sides don't love that there has to be a group to compare to, because of course we would want to serve everyone if we could, but we know that this step of studying it and making sure it's effective is really critical, so that we can better serve people in the future. But we know the importance of it for just the research side and understanding the effectiveness of our program. And then we've talked a lot about like things that could influence our results, such as receiving outside services. We've been debating that a lot, and what would maybe impact results. So there's just a lot of really critical considerations that make this tricky to implement in the real world. But we try to communicate regularly and collaborate, really try and hear other people's perspectives and learn where we can be flexible and where we can't. Where can we like relax a little bit on some of maybe the like research protocols, and where do we have to really hold the line to make sure that we maintain rigor. So I'm going to quickly go through what we've learned so far, just so you know who is on our program right now. We've currently enrolled, over the past year, enrolled 62 caregivers across both groups. We have had a little bit of attrition, but most of those have completed their time. About 68% identify as Black or African American. The majority, which was 34%, are actually in their 40s, which I think is a common misperception. A lot of times people tend to think that all kinship caregivers are much older, grandparents, great-grandparents, but that's not necessarily true, or what we're seeing in our sample. They're all women so far, and actually almost a quarter have an annual household income of less than $20,000. So we know that there is some significant need there in the folks we're serving, and we really try to be responsive to that. We have very preliminary findings right now because our program is rolling. We are not getting all of our post-survey data at one time. So just knowing that we have a small sample size right now, very preliminary analyses are showing positive improvements on average across scales that are measuring well-being and stress and the relationship between the child and the caregiver. And then there's a little caveat that there was one data point that seemed a little iffy. And so when we removed that, we also saw some other, on average, higher scores post-program on how they feel about having social support and their satisfaction as a caregiver. We also have found really rich qualitative results. Our focus groups, our caregivers have been saying a lot of the same things across these conversations. And the first thing was that they felt less alone. They really appreciated the sense of community that they built. They didn't want the program to end at 6 weeks or 6 months, sorry. They also really learned a lot. They found that the trainings and the resources shared by others were really helpful in directing their efforts to support their children. And I'm going to wrap this up with just 2 quotes from our caregivers, because we think they're we want to let their voices be heard. So this first one I love. It says, "I never thought that something so simple would change my life forever. I experienced so much overwhelming support when I was at my lowest point in life. I appreciate everything this program has given me." And this caregiver was talking a lot about community, saying that everything to me helped me, because it gave me, like, even with talking to people in the support groups and getting everybody's input, everybody's going through something. So it all helped. And the peer liaison checking on me and her, building a bond. And with Tamara, our service coordinator, and everybody helped me out. It really made a difference, and it's making a difference. So even though our results are preliminary, we're really encouraged by what we're hearing, and we're really honored to have the opportunity to help people and improve their lives. And so we're hoping that our continued evaluation will show that as well. All right, but you've heard a lot from me, so I would love to turn it over to our other stakeholders. We are going to have a panel for most of the rest of this session. We have one of our loveliest alumni here, Miss Angela Parker. We have our peer liaison, Miss Phyllis Schroeder, who you met yesterday. It's Rachel Hatton Moore, who is one of our advisory council members. I'll let each of them introduce themselves as well. You met her on the first call. You met Tamara Scott yesterday, who is our service coordinator. All right, welcome. Thank you so much. I appreciate you all taking the time to be here and to share your stories. I'll call on you for the first question or two, and then feel free to just chime in whenever. So if you can each take about a minute or two to just introduce yourself and share your story, the background, of your caregiving story or how you came to work in this space, and how you got connected to Kin Carolina.
Okay.
Yeah, go ahead, Miss Angela.
I'm Angela, and I am the grandmother of 3 of my grandchildren who I am raising now. And I came upon this through my daughter-in-law, who was trying to help me because I was in such a state that I really didn't know what to do. I was it happened really fast, and I am a full-time worker, so I just didn't know what to do. And she lives in Virginia, and she found the organization, and I called and left a message on a Thursday or Friday. And I do believe that Monday or Tuesday, I got a call back, and I was thrilled, a little nervous, but excited. And Kin Carolina has just done wonders just from the talks that we've had, the people that they've had to come in and explain things that, we don't understand a lot. And I didn't. And it was very helpful, and it has been, and they're just wonderful. And I can never thank them enough.
Thank you so much for sharing. And we are so glad that you were connected to us because we've loved having you and glad that you're still involved with us.
Oh, yeah. And then the activities for the children and getting us all together and not feeling like we were alone, because we weren't. We, at any time, calling and checking on us, having our meetings, and just everyone sharing. It's wonderful. I really, it meant a lot to me, and it still does. And thank you.
Wonderful. Thank you so much. Phyllis, do you want to go ahead?
Sure. I'm Phyllis Schroeder. I am a peer liaison, but I'm also a caregiver. I'm raising a 7-year-old granddaughter. So I started out with a local agency supporting me in Kinship. And then when Kin Carolina got started, I believe Tamara said, "Hey, you'd be a great peer liaison." So I went through that application process, and here I am. But I feel like the lived experience is huge. I got custody of my granddaughter when she was 16 months, and just being able then to relate to people in the same situation. But also, as a profession, I was a special ed teacher. I'm an early interventionist. So I have a lot of connections in the community that way when we're talking about kids with disabilities. And even though we do that so broadly, because trauma in and of itself is a disability, I feel like I've been able to really plug people in, and be a listening ear and a shoulder to cry on and all those kinds of things.
Thanks so much. And we're so happy that you're with us.
Thank you.
All right. Next on my screen is Rachel. Do you want to go ahead and introduce yourself?
Sure. I'm Rachel Hatton Moore. I'm the 2-generation systems manager at the Early Childhood Advisory Council in South Carolina First Steps. And in that role, it's really my responsibility to help other agencies, specifically public agencies, build a system of care around whole families. And I also have experience being in a kinship care family. My parents raised my nephew, and also really helped a lot in the care of my niece. So I really understand a lot of the challenges that brings. I've seen them firsthand, and I helped navigate a lot of those for my parents. I'm just really, I care a lot about that. And then it's also been a part of every role I've had. I'm also a social worker by trade and training, and have worked with specifically grandparents raising grandchildren in all of my roles. So thank you for having me be here. I'm also a member of the advisory council, and happy to talk more in a few moments about the importance of research and systems building.
Thank you, Rachel. I think the second I met Rachel in a meeting, and I don't remember how we got connected, but the second I met you, I was like, you must be on our advisory council. Like, let's make this happen. And you've been such an asset. So thank you. And last but not least, Tamara, do you want to introduce yourself?
Yes. Hi, everybody. My name is Tamara Scott. I am the service coordinator for Carolina, and I also serve in another role as the benefits specialist. My role with the service coordinator, I help navigate with the kinship caregivers, talk to them, make sure they're okay, and I also supervise the peer liaisons. As a benefits specialist as well, I provide supports to make sure they're eligible for services. And my journey began as a kinship caregiver from my lived experience during COVID. My daughter had my grandson Jackson, and she was young. And so, as a young parent, it was hard for her to navigate initially. So, she left for a little while and she came back. And so, my goal was to set boundaries for her and her boyfriend to make sure that Jackson was okay. That was our main goal. And so, now she is a wonderful mother. She's doing well. She has moved out, yay. And she has my Jackson with her. And so we co-parent now. And so I see him often. I was connected through Kinship Care through our community partner, Kindred Hearts. And I also did a lot of work with kinship caregivers prior in my previous job as well. And so I'm just thankful to be able to, on a daily basis, be able to talk to kinship caregivers, reach out to community partners, and just learn. Just learning from them as well. I always tell them in our support groups that, I don't know everything, but I learn from you all as well. And so I love that feeling that we're like a family. And so that's my journey.
Thank you so much. I appreciate you all sharing your backgrounds. And as you can tell, this is like a point of passion for all of them. So I'd love to hear from each of you, from each of your roles, what your experience has been like. We've been implementing King Carolina for a year. What has that experience been like for you? And what have you personally, or if you want to reflect on like the caregivers or more organizationally, what have been some of the impacts?
I guess for me, the impact has been amazing as far as meeting the caregivers. Um, Again, I have met some who have been through a lot of challenges in their lives, such as myself, but they were able to power through that and come out becoming advocates for not only themselves but for the children. A lot of times when they come into the group, they make the statement, I didn't know, I felt like I was by myself. And so when they're in that environment, it just feels good to know that they have that feeling of understanding that goes through something, different circumstances, different ways that they come into kinship care, but we all have one thing in common is to make sure the child is safe.
Thanks so much, Tamara. And how have you seen the caregivers like grow and change over the course of the program?
Oh my goodness, we had one to write a book. She was influenced, in regards to um, she wanted to make a difference because she has a child with autism. And so I used that as one of my support group things as well, about his superpowers. And so I was really proud of her for that. We had one to um, go back to nursing school. She talked about that. And she felt like the support that she received from not only support group members, but her peer liaison is what helped her get over that hump and that fear that she had to move forth and go forth. And a lot of our caregivers have transferred over and continue their process and their journey through our community partner. And so that means a lot that they want to continue growing in the future.
Awesome. Thank you so much for sharing that. Anyone else want to share their experiences?
I'll share mine from the aspect of being on the advisory council. So we've had quarterly meetings where we all come together across our sectors and really learn from each other and share the experiences that we have with the way kinship caregivers interact with our agencies and departments. And then we also have like sub-work groups for things like data sharing or systems building or, training and outreach, such as the Kinship Caregiver Town Hall planning. And so that's been really helpful to meet with other professionals who all have a stake in the game, so to speak, and then also, a real desire to sort of bring each other together in support of families.
Thanks so much, Rachel. We've learned a lot about resources and just perspectives from all the members of our advisory council, you included. So thank you. Phyllis or Angela, do you want to share? How has this past year, what has the experience with King Carolina been like for you?
In Carolina, like I said, and it wasn't just an impact on me, but it was an impact on my grandchildren because it helped me see things that I wasn't seeing, or it was there, but I didn't understand it. And of course, I've had my children are all grown, and then I get my grandchildren, and things are so different. And I just didn't, I needed that help, that guidance. And that's what Ken Carolina gave me because I was able to interact with other grandparents and y'all had people come in and speak with us about just ADHD, which I never had a child with it. I didn't know what to expect with it. And all the information was just wonderful. I think it helped me. And of course, I got my grandchildren diagnosed and they do have it and they're put on medicine and it made a world of difference. It's just like day and night. As of before, I would have never known to go ahead and take that step to do it. So there was so many things that Ken Carolina opened my eyes to that helped me and helped my grandchildren. And it was great. And I want to help other people. I tell everybody about it, but there's not, there's a lot of things that when you do become a caregiver and your life changes, you get that call and you make that decision. And this is what my life is. I'm going to give these children stability and learn and do everything that I can to help them. And that's what Ken Carolina is helping me do.
Oh, that was beautiful. Thank you. And you're doing a great job because we've met your grandkids at the Kinship family outings and they are lovely, just like you. So
thank you. They are sweethearts. They have big hearts. And to be gone through at a young age what all they've gone through, they're just, like I said, I had the paper, but I needed the pencil. And y'all gave me that pencil and that helped me put it together and it helped not just myself, but it helped them. So thank you
so much for sharing that.
Absolutely.
So from a peer liaison standpoint, like I've had lots of different families. And I think one of the things that Angela was alluding to as grandparents raising grandkids, society and the world that our grandkids are growing up in is way different than the world that we raised our kids in. And so being able to relate that, because we've got to do things differently than we did with our own kids because they're growing up in a whole different kind of world. So I think having somebody to help navigate that with you is very helpful. And it continues to impact even my granddaughter in that when I build a relationship with a caregiver and they've got kids, we do things together. So then she's seeing other kids who live with their grandparents. Because I think we talked about this yesterday, what do you say when someone says, well, why do you live with your grandma and not your mom, and so it gives them that camaraderie and that sense of belonging, just like it does for the caregivers.
I love that. Thank you so much, Phyllis. And I'm sure that means so much to the families you're supporting too. So my next question, like we said, this is a research project, although that's not first and foremost for us, but there is a big research component. From each of your perspectives, what is it like being involved in a research study? And have you seen any benefits to being involved in that?
I appreciate the research part, and I know that it's really important. But like you were saying earlier, Amanda, it's hard because of our hearts and how we care for all these families. It's hard to see people not get everything, and so I love that we're giving them something. And then I feel like, when their 6 months is over, then they get plugged in other places. I think that's really important that we are following up with them, the people who don't get randomized for the peer liaisons. We're still keeping in touch. We're still following up and making sure they get plugged in. Because other than that, it would be really hard to, say like,
Yeah.
okay, well, you're not going to get anything, and we're going to see how well these people do that are getting something. And so I think that part of it is hard, but I know that in the end, it's going to pay off so much because I know we're making a difference. And so I know that later down the road, we'll be able to give everybody what they need.
Thanks for sharing that, Phyllis. And that's real. Like it is not easy to say no to someone, or to say like a sort of no to someone. And even I hate, in my role, screening out someone who like lives in a different area. I hate saying no to them too and try and connect them places. So it does make it difficult for sure. Tamara, did you want to say something?
Oh, I think Phyllis did a great job expressing expressing research. So thank you, Phyllis, for sharing that.
And feel free to share too how research has impacted like your own experience in the program, because everyone has a role to play in carrying out the research study as well.
And just from my standpoint, not even working directly with the families in the study, just knowing that the system building aspect of it is also being like looked at, and our involvement and awareness of kinship caregiving. But as a social worker and someone who works in social services, like all of us and many of us on the advisory council, it's really important to think about how we're contributing to the field building aspects of research, and how we help sort of guide the experience of the people involved in it, making referrals and things like that, and how we're leveraging that to really advance the knowledge of like our entire body of work, not just this one study.
Right. And I know we talked earlier about the caregivers and how they have their support groups and what they get. But we also have that, which is huge for us. But, part of the research for us is filling out those questionnaires every week and saying, like, how did we touch base? What did we do? What did we give them? How do we connect them to other services? So I think that's our big input to what comes out on paper. I mean, people will tell you that we help them, but seeing on paper what we've done, I think that's our research part.
Thanks, Phyllis. And yeah, that makes such a big difference, because every person is an individual, right? So how you support your caregivers is going to look different from how one of the other peer liaisons supports theirs. And so you helping us fill out those forms helps us see like the big picture of what does peer liaison interaction, or what do they look like for our program. And so it is really helpful that you do all of that, even though I know I'm sure it's tedious. I want to give Angela Parker a chance to share, and then Angela Tobin, I saw you took yourself off camera, so I'll get you after that.
I want to say too a minute that being a part of this, and I think it's like, where have you been? I'm so glad that that Ken Carolina has come into my life, and being part of just, whether it be through taking a survey or answering questions or whatever will help someone else. I feel like that's what we need to do, because how's anyone going to know a survey or what has been going on if they don't hear about it? And I think this is awesome. And I'm so glad that it doesn't matter to me. You ask me anything, or I'll do whatever I can to help you guys, because I feel like it is so important, and we need to get out there to some of these parents and grandparents that don't know about it, that they're missing out on so much. And it's so important because, like you say, y'all, I could call you and say, I need help with this or that, or I'm not sure about what's, and you did something. You made me feel so comfortable that I opened that door and I told you how I really felt and what was inside me and what I needed help with. And you did that. And that's not something that I normally do. But I was so comfortable, and that's important. So research is wonderful. And whatever we can do to help another grandparent with its raising their grandchildren or niece or nephew or anyone like that, if they need it, then let's do what we need to do to get it to them. And I can't thank you guys enough.
Thank you
Well,
so much for sharing that.
oh, thank you, hon.
Thank you, Angela. So hard to follow that up. You're making me a little teary-eyed. But I just wanted to share from my perspective on the team. So I do work with those that are randomized into the services in the community group, or the control group, we say in research. And just to say, we do provide support too. And we set up an information session with them. So we go through everything that they can expect in terms of the monthly logs, and then also pulling up that resource guide. And I know we described it as like a 70-page document. We have made it so it's actually like clickable to click through. So if they're looking for specific services, they can click on that and it will bring them to that part of the document. And it also is organized by county. And it's cool to see when they first see the document, they're like, oh my goodness, like I had no idea all of these resources are out there. So it's not just like sending them a document and saying good luck. We really do try to walk them through it and to give them support too. And I feel like I've been able to build connections with them in a way, sending them the monthly emails, following up with them, letting them know if they have any questions. So just to say, we truly like try to meet everyone where we are and do everything that we can, even within the context of the research, to be of support and to open that line of communication. So they know that we are here for support as much as we can be. And again, that transparency process is very important. And as Amanda said, in that consent meeting, we walk them through everything. I always tell them this is probably more information than what you're expecting, but we want you to know everything. We want you to have time to ask questions. And we say, if you decide like a research study isn't for you, just know there are other supports and services out there. So we really try to respect families' autonomy and choice in deciding if this is a good fit for them. But yeah, I love what everyone else on here shared. I'm going to go back to turning my camera off. I just wanted to add that in.
Thanks so much, Angela. I think that's really helpful context, that it's really not a dismissive thing to be put into our services in the community group. So I appreciate you sharing that. So Angela Parker just shared a minute ago about basically our next question. So for those with lived experience, how did it feel to kind of share your experience with others? I know in the focus groups, a lot of times the caregivers say, I had my camera off during the support groups at the beginning. I was really nervous. I just listened. So if those of you, Phyllis, Tamara, Angela, if you want to share, if you have more to share, how did it feel? Like, how did you overcome kind of that discomfort maybe with sharing your story?
And even Phyllis, I'm curious to hear how maybe you helped others like open up in sharing too on your peer liaison side of things.
Yeah, I mean, because I don't have any problem sharing anything. And ever since I was real little, my mom said I never met a stranger. So I don't know if most people, not everybody, but most people seem to open up to me pretty easily, because when I first meet somebody, I already feel like we're friends. And we've got 6 months. I don't want to waste weeks of it getting to know you on a superficial level. I want to dive right in. And most people have been really open to that. One of the new caregivers that I'm serving now, was recently sick. So we texted for a little while, and then we finally got to talk this morning. And so when she picked up the phone, I was like, hey, how are you? She's like, this is the first time we've talked. I was like, yeah, but we texted all week. So like, we're already friends, So I feel like that makes a huge difference, is just the way that you approach it and people open up. And I heard all kinds of things in that conversation. So now I've got my work cut out for me and finding resources and walking her through some things.
Well, thank you for making others feel more comfortable sharing by modeling that yourself. That's great. Tamara, did you have anything to add?
Just to piggyback off of Phyllis, I think just being yourself, your authentic self when you're talking to families, that's what has been successful for me, just being transparent and then being that person that they need whenever they have questions, whenever they want to talk to someone, as well as the peer liaison. Sometimes they'll contact the peer liaisons, and sometimes they'll contact me as well to get other information as well. But just having that open door policy that I'm here for you whenever you need me, call me. I think that makes a difference. I would say for the support groups, we make it easy for our caregivers to share because we have it set like a family setting. And so when they come in, they know that they're going to get that support. They're going to be encouraged with one another, and they're going to cry, laugh, scream, whatever they want to do. That's their safe place. And I always say what happens in Ken Carolina support group stays in Ken Carolina support group. So just letting them know that they're there. This is a non-judgmental zone, and you can say whatever you want to say, and we're here for you.
Thanks so much.
Mhm.
Did you have something to share, Rachel? I saw you come off mute.
Yeah, I know that one of the things that we talked about early on when we met was that I'm the facilitator in my own job, not as as an advisory member, the facilitator of the Early Childhood Advisory Council Family Voice Council, which is parents of young children and caregivers, kinship caregivers of young children who have participated in the early childhood system, and just sharing their lived experience and having that peer support and building that social capital, to share their stories out more widely just really lets people know that they're not alone, and that those stories create change just by telling the story. And so I think that's really important too, is just like to let people know that their lived experiences has power, not just to share with like one person, but it has a ripple effect throughout communities.
Yeah, and I tell our caregivers that too with the focus groups. Like everything we keep their identities confidential, but like I shared in the earlier presentation, I love using their quotes because they're so much more powerful than anything I could say. And so that is a form of advocacy. A few caregivers have said to me, even like Angela mentioned earlier, I want to speak out, I want to help others, and I've said that like using your voice that way and telling your story does as well. All right, I think our final question, before we get to some Q&A, in your experience, how has Kin Carolina worked to meet individual needs and make the program accessible to all members of the community?
So I know support groups are available online for sure, and some during the day and some in the evening. So that is really helpful. Allowing us as peer liaisons to use whatever methods work best for our caregivers to be in touch. Sometimes we're texting, sometimes we're calling, sometimes we're meeting for coffee, or we're taking the kids to the park together. So all of those different ways of meeting their needs and meeting with them, I think opens it up, because there are some people, like I've had caregivers who live an hour away. Like obviously we're not meeting for coffee, but we can talk on the phone and we can Zoom. A lot of people, generationally, a lot of grandparents do not like to Zoom or don't know how to Zoom. And sometimes it's like, oh, I'm gonna get the kids to get me on. So that becomes challenging sometimes, but they're very willing to talk on the phone most of the time, and that's good.
Thanks so much, Phyllis.
Again,
Go
I'm
ahead,
gonna piggyback off of Phyllis again. I think having that broadness, the where we can do the virtual and adding different communities, it just brings more people together. And so they don't have to worry about the cost of transportation, like Phyllis stated, getting to this place, getting to this place. But being able to sit in your own home at a certain time, eating dinner with your family, but being able to participate, I think that's very helpful for families because we might not always want to go in person, and sometimes they don't turn their cameras on. It's okay as long as you're participating. And so until they feel comfortable. So I just think it opens a lot of doors for families to be able to not only see things in their community, but see things in other communities as well, and be able to share different insights with one another. So it's a good opportunity.
Thanks, Tamara.
But then I
Yeah.
think, Angela, did you go, you went to some of the family things. I think that was huge.
Yeah, that's
You
huge.
know,
Yeah,
that if you've only been talking on the phone and then all of a sudden you get to meet each other, like
Yeah.
that's amazing.
yeah,
That's amazing. Yeah.
And for those who we've done we're trying to do it every 6 months or so, 2 family outings, and we've done them in conjunction with Adventure in Columbia and the South Carolina State Museum in conjunction with their accessibility and sensory days, so that the kids can come and feel comfortable. And it
Mhm.
also connects Miss Angela, I hope you don't mind me putting you on the spot, but I remember you saying like it would have been hard for you to be able to bring all of your, I think you had a nephew with you too, like all of the kids
Yeah.
to the museum. Museums are not cheap. And I said, no, they're free every month. Like, so to be able to also highlight the resources in the communities for families is great too. But go ahead, please.
Absolutely. No, I was just going to say the Zoom was a new thing for me on my phone, and my grandchildren did help me with that. So that was one thing. But it was nice that I could tap in on the Zoom, and yeah, it's nice to be in meetings and be able and the groups together and see everybody, but to be able to get on the Zoom and just listen and if you wanted to come on, you could. And if you didn't want to show, you didn't have to. But then, I didn't have to worry about anybody keeping the children. I think that was at first, that was really hard for me because going through everything that we went through, I just couldn't have anybody watch the children. It had to be, someone that qualified or which is a big thing because you can't just say, oh, let me get my neighbor to watch them for a minute. And so that was a big thing for me, and I liked being able to, I was working from home at the time, so I was able to go in to the office and shut the door and say, okay, Mimi's going to be in here for a minute, a little bit, and just connect with everyone. And I can't tell you how many times that it just brought so much out of my heart because it was what I needed, and it was what I needed, and that's was a lot for me, and I appreciate everything, absolutely everything.
I
So
Thank you for
And if
sharing.
you're
I have
like
a
me,
follow-up question. Oh, I just have a quick question. Ms. Angela, since there are some people on our call who aren't as familiar with kinship care, do you mind explaining why you couldn't just have anyone watch your kids? Was that like a requirement or?
yes, through DSS, we were going through a lot with my daughter and her husband, and me being, I was also going through becoming foster parent for them, and you have to have, they have to know who the babysitter is. They have to have a background check, and so it wasn't just I had one person, and that one person wasn't available all the time, and so therefore, because that's them watching out for me, watching out for the children. And, when you become a part of the system, they pretty much know a lot of everything about you. So you have to be just opened up and, open your home because you're having people in and out. You're having to, put a fire, like if we had a fire, what are our plans? You have to have fire detectors. They want to know, what kind of food is in your home and how are you taking care of the children. And when I remember telling one of the ladies that I was a part of King Carolina, and she was just like, wow, I haven't heard anybody say that. I was like, wow, y'all need to start giving out the number because it's very helpful and it's very rewarding. And thank you.
Well, thank you. And thank you for explaining that too, because I think that might not be like intuitive for someone who hasn't been through it. Like, yeah, why can't you just get the neighbor? So I appreciate you explaining
Yeah,
that a little bit more.
absolutely. Thank you, hon.
Yeah. Angela, Tobin, did you want to weigh in?
Yes, but I just wanted to give a huge shout out to Tamara too, our service coordinator, because Tamara truly does meet all the caregivers where they are. Like we make sure they know when the support groups are. We send out the monthly flyers, we email reminders, we text reminders if needed. So it's not just like, hey, the support groups are twice a month, here are the dates, make sure we come, but it's really having that personal connection. And the peer liaisons are also encouraging them to attend the support groups and trainings. So it truly does take a village. But I did want to just uplift Tamara because she really does go above and beyond to make sure caregivers are able to participate. And it's not just like, a one size fits all. It's really meeting each caregiver where they are. If they need help with Zoom, let's log on early and do a practice session. You know, if your Wi-Fi is not working, you can call in. We actually had a caregiver like drive to McDonald's to use their Wi-Fi because after the storm, her Wi-Fi was down. It like just meant that much to her to be able to join. So I think accessibility, it's part of like the things that we do, but also just how we approach connecting with caregivers and making sure that we oversee any barriers that they have to participating. So I did just want to highlight Tamara there.
Thanks so much. So
Thank
I'm
you.
seeing a lot of questions in the chat, so we can start opening it up. I did want to address the one question that came through the Q&A. Since we've been talking about research today, the question is, do you have plans to publish journal studies or peer review or submit even to the National Clearinghouse for Evidence-Based Practices? And the answer to all of that is yes. We definitely, that is a big goal of ours, is to become an evidence-based practice. And that is why we were really like shooting for the top in terms of rigor and our research design. And like I said, we really only have a small data set right now because our results trickle in because of the way people enroll, because they trickle in. And so that's definitely in the future, but we want to not only disseminate our results with like the academic community, that's important, but also through things like this, where we can reach other people who are in the community who can put what we're finding into practice. We don't want it to just be exclusive to university researchers, even though some of us identify that way. We want it to be really communal. So thank you for that question. I saw another question in the chat. How do families learn about your program? It sounds like for some of us on the call, it was word of mouth. Does anyone else want to chat about? I mean, I can answer that, but other people can certainly answer as well, how we share.
Well, we go out in the community, different events. We'll have a table set up and we share there. We've taken flyers to guidance counselors at schools. I've seen flyers up at the library. I saw a flyer at one of Evelyn's doctor's appointments. So I know that we as a body are out there promoting for sure. And then there's a way to refer people on the website. So once they can, see a flyer or introduced to it, then they can get referred to the program that way.
Thanks, Phyllis. And you and Miss Pat, who was on the call yesterday, are, our event rock stars. So we appreciate.
We have fun doing, but it's a lot of fun though. People come up and they want to know what we're all about. And so we just get to share and it's nice.
Thank you. I see a question about the flyer. We can send that out with the other materials that we're sending out next week.
These came on earlier in the chat. Someone asked, are families eligible to receive your services if they're licensed through DSS as a kinship provider? And the answer is yes. So we serve kinship providers, whether they're formal or informal. What we really look at is their relationship with the child. Are they the primary caregiver for the child, and does the child live with them? But there's no like legal requirements beyond that. We also had a question earlier, are the peer liaisons currently in the program, or are they program graduates? So our peer liaisons are not current program participants. They are graduates or they are community members who applied to be peer liaisons. Part of that criteria is that the caregiver has at least 3 years of experience as a caregiver and is living in the areas that we're serving. So on our website, we do have a peer liaison page and there's an application there, but we're excited to start onboarding some of our graduates as peer liaisons. Once they're done with the study, they are eligible to apply. And then the other question I didn't have a great answer to. I don't know if anyone has a better answer, but they asked if there's similar services in other regions of the country, and they were specifically asking about the Northeast.
Well, I think I saw in the chat, Angela, you mentioned the one that we found. So before we did this program, or before we developed this program, we did a lot of research to not only figure out which components had an evidence base already. So each of the components that we have an evidence base. So support groups, peer liaisons, educational trainings, and the financial support all have their own research base, but not together. But we also were looking for other programs. I think even our funding application asked for that, like who else is doing this work? And we came up kind of empty for this particular population, especially. So I think Project Grand, I think, is in Atlanta. We did find that they are supporting grandparent caregivers raising children with disabilities. But if anyone knows of other resources, we'd love to connect to them too. So feel free to use the chat as a way to share. But first, thank you to our panel. You all are wonderful assets to our team, and I appreciate your authenticity and willingness to share things that aren't always easy. I think a lot of people benefited from hearing you today, so thank you very much. What is something that you learned or something you can implement from what you learned today? It truly does take a village. Yeah, and I think sometimes our caregivers don't always feel like they have that village, so putting ourselves in their shoes, I think, is the best thing those of us without that lived experience can do.
Oh, Mary Jane, that's a great point. And thank you for highlighting this. She said, still learning and interested in a presentation if possible for my social workers. So we do provide presentations if you're interested in having your organization learn more about Kin Carolina. I believe you all have Amanda's email, so you could reach out to her, and we'll arrange something virtually or in person, depending on where you're located, to connect with your team. But we're very happy to come in and provide information and support. And we also can provide some information about kinship care as well, in addition to Kin Carolina.
I love this comment. Thank you, Angela, for sharing that. I love this comment that just came in, reminded of the value in working to connect people to existing resources. Sometimes it's not that the resource isn't there, it's that people aren't linked. I think that's brilliant. Yes, there are so many people in this situation. That is right. We are so glad. And let me just say thank you to everyone who joined us, especially if you joined us 3 days in a row. We have really been enjoying the conversations we've been having with you all, and please feel free to keep in touch with us. Yes, and round of applause for our panelists. Absolutely.
It's great to see these reflections. Thank you. We hope we brought you into our world a little bit.
Oh, a question came in. What is Kindred Hearts? So Kindred Hearts is, and Tamara, maybe you're the best person to answer this question, but they are a community-based organization supporting kinship caregivers. That is we call them our implementation site. Tamara, do you want to share a little bit more?
Yes, Dr. Jaha is on the call as well, but they provide supports, kinship circles. She brings in resources on the fourth Thursday of each month where the community partners come in and talk about services that are supportive to kinship caregivers. We eat and we fellowship together with the kinship caregivers as well, and she also provides a virtual option. Once the caregivers complete Kin Carolina, they transfer over if they choose to continue with supports to Kindred Hearts. And so Kindred Hearts has been in the Columbia region, but she also serves outside of Columbia as well to make sure that families have what they need. And so if you call her, she's going to help you. And her motto is, if the caregiver is not okay, then you're not going to be, the child is not going to be okay. And so she's going to put her information in the chat. It's in the chat right now, so you can look her up and see the good things that she's doing within the community.
I would
Thank
like to
you.
say something, Tamara, on that too with
Yes.
Ken Hearts. They are awesome. They just one little thing that
Yeah.
just being part of them too. Like if you need something for your children, just
Yes.
like a couple of weeks ago, the church had a yard sale. They contacted everybody and said, "Hey, if you need anything for your children, we are going to be here, and you come. And if there's anything that you need for them, just get it." And it was really nice. And that's what they do. And that's what we need. And we need more people to know that they're here for us. That's so important. If I could get on a mountaintop and shout it out to everyone, I would do it, because things like that are awesome. And I've been to the meetings, and I've eaten and shared dinner with them, and just shared my emotions and my feelings, and my grandchildren. Oh Lord, they keep me so busy.
Yeah.
We make it. And it's people like you guys that care about us. And I just don't know how to thank everyone because it is so important. It's so important, like I said, not just to me, but for my grandchildren, because it helps me to deal with things with them. So I love you guys. Thank you.
Mhm. We love
Love
you
you
too. And
too.
I think we should end the conversation on that because Miss Angela always knows the perfect thing to say.
We did have a quick question earlier on, and she said a kinship caregiver has been doing it for a lot of years. Is she still eligible? And the answer would be yes. As long as they're kinship caregivers, they just have to be caregivers for at least 1 month when they apply, but there's no maximum time.
And if that caregiver feels like they might want to be a peer liaison, we're always accepting applications for them as well if they feel like they want to give back to others. All right, thank you all so much. I think we're going to close this out, but we so appreciate you being here. We have had a wonderful week with all of you, and we're glad to see that people have gotten something out of these sessions. Thanks again, and keep in touch. Bye, everyone.
Hi, thank you so much. Don't hesitate to reach out.